Do you have metabolic syndrome, sometimes known simply as Syndrome X? Well, is statin therapy part of how you're treating it? And is that helpful for this condition? Let's discuss that. Stay tuned. So what is metabolic syndrome? Well, here's a definition from the Johns Hopkins University. It's the presence of a cluster of risk factors specific for cardiovascular disease. And that's the key. We're talking about your metabolic condition and its effect on cardiovascular risk. And you're diagnosed with it, I guess, if you have 3 or more of the following: insulin resistance or type 2 diabetes, obesity or belly fat, low HDL, high triglycerides, or hypertension. You know what's not on here? LDL and total cholesterol aren't on here, and I think that's kind of telling. So how's it actually diagnosed? Well, there's various organizations that have slightly different criteria. So I looked at all of these and I kind of matched them together. There's the International Diabetes Foundation, there's the World Health Organization, the European Group for the Study of Insulin Resistance, the National Cholesterol Educational Program, and the American Heart Association. So I took all these organizations and looked at their criteria, and I came up with kind of a consensus of what they consider to be metabolic syndrome. All of them say 3 or more of these 5 conditions. In the matter of insulin resistance or type 2 diabetes, they look at fasting glucose. They don't really look at HbA1c, and there's a very good reason for that. A low HbA1c can hide insulin resistance. You could be very insulin resistant, but if you're not subjecting your body to a lot of carbohydrates, you could actually still have a low HbA1c and still have considerable insulin resistance. That's actually the case with me. I have an HbA1c that is under pre-diabetic levels, yet I do have considerable insulin resistance from a lifetime of being a sugar addict that I didn't break until I was like 60 or 61. So I'm paying for that now. I do have insulin resistance, trying to correct it, but I do have a fasting glucose quite often over 100 because I have considerable dawn effect. Next criteria is obesity or belly fat. Now it's interesting, they just use a waist size of 40 inches or more. Means you have belly fat, and less than 40 inches means you don't. That's obviously too simple. If somebody's 5 feet tall and they have a 40-inch waist, that's very different than somebody who's 7 feet tall who has a 40-inch waist. But they're looking for belly fat, and that is the kind of fat that indicates kind of fatty liver disease, I suppose. So, you know, they don't use BMI. Well, some of the organizations actually use the obesity level of BMI. Recent studies have actually shown what is considered overweight by the traditional BMI measure is actually not that dangerous as far as cardiovascular disease risk. But once you get into the obese level, it's a problem. Low HDL. For some reason, men get a break that women don't. That's under 40 milligrams per deciliter, or approximately 1 millimole per liter for men, or less than 50 or 1.25 millimoles per liter for women. High triglycerides pretty consistently is greater than 150 milligrams per deciliter, or 1.7 millimoles per liter. Hypertension. Some of the organizations go a little higher, I think 140 over 90, but in general, high blood pressure, 130 over 85. Either number is high, you check off that box. So if you get 3 out of these 5, you've got the consensus diagnosis. But there's a big oops here, and that is for high blood glucose, low HDL, high triglycerides, and hypertension. In other words, everything but obesity. Most of the criteria include this caveat. They say, or drug treatment for the same condition. So in other words, if you have high triglycerides, or you're being treated by some drug therapy, probably statins, for high triglycerides, you still check off that criteria. So to me, that is a tacit admission that the drugs did not help as much as the results obtained through lifestyle. I mean, they're saying it doesn't count as far as whether or not you have metabolic syndrome. I don't know what they're going to treat beyond that, but that's the criteria. So the question that we wanted to address in this video is, do statins help with the metabolic syndrome? Well, by the definition that we just went over, they don't, because they are drug therapy, and that drug therapy caveat says no, you don't get to cross that condition off and subtract it from your 3 out of 5. That's really too flip of an answer and too simple, I think. It would be really unfair, and we wouldn't be doing our due diligence if we just accepted that answer. If we look at the risk calculators, you know, the pool cohort equations that I talked about in earlier videos, as an example, blood pressure meds results, the results you get from them, they do not fully benefit the patient. In other words, if you're at 120 over 80 on meds, that's not as good as being 120 over 80 naturally. It's better than being 140 over 100 not on meds, but you don't get the full benefit of that. And it's kind of ambiguous for statins because they don't really ask whether you're on statin therapy or not in most of the calculators. And I did find some risk calculators that did include that, but they didn't seem to make a difference. It's almost like somebody thought about it and said, this should make a difference. Someday maybe we'll have the data to back that up. So think about it. If you are on a statin to raise your HDL or lower your triglycerides, there's an assumption there that the triglycerides or the HDL isn't a symptom or a reflection of your health, but is actually the cause of your health. And if that's not true, and maybe it's true for some people, maybe it's not for others, then treating this symptom with a drug is treating the symptom artificially, and it's not actually getting to the root cause. So in that case, we'd say they might not help. Also, there are some small studies out there that I was able to find that indicate a couple things about statins. Statins block the exercise-induced change in fitness. Simvastatin impairs exercise training adaptation. So in other words, what I have been saying all along, at least for me, statins did interfere with my ability to exercise. Well, there are small studies, probably not large enough participants for us to say for sure. I mean, let's be fair, if we're going to require positive statin results to be large numbers, then the negative statin results we should also require larger numbers, but they kind of indicate that any benefit you get from exercise is just negated by the statins or prevented by the statins, might be a way to put it. So what's my answer? To be honest, if you're not actively addressing your metabolic syndrome by way of diet and exercise and etc., could be mindfulness, meditation to reduce stress and blood pressure, that sort of thing, then statins probably help to some degree. I mean, statistically, we hate to admit it, but there is a relative risk reduction. The typical figure I always throw out is the one from the Lipitor ads, 36% relative risk reduction. So if your risk is 11%, you're going to get like a 4% absolute risk reduction out of that. But if you are actively addressing metabolic syndrome by way of diet, by way of exercise, then the statins are probably going to interfere with your efforts. That's my answer. If you're just going to sit there and be a couch potato, no value judgment there from me. These medications will probably help. If you're actively addressing it, these medications are actually going to interfere with what you're trying to do. So there's one other point that I want to address. This is kind of like a sidebar, and that is I usually give values in these videos in terms of milligrams per deciliter because that's the common units used in the United States. You know how the US is, they're still doing, furlongs per fortnight for speed. But the rest of the world uses millimoles per liter, but they don't convert the same way. So the question comes up, why do different substances convert differently? I mean, it's one unit to another unit. For example, cholesterol, whether it's HDL, LDL, or total, 1 millimole per liter is about 39 milligrams per deciliter. Okay, conversion factor. For triglycerides, 1 millimole per liter is about 89 milligrams per deciliter. That's kind of counterintuitive. You say, well, wait a minute. We're just converting from one unit to another unit. We'll get to that. And for blood glucose, it's like 1 millimole per liter is about 18 milligrams per deciliter. Well, why are these different? Milligrams per deciliter is a mass over volume measure. That's what I guess I would call density. Millimoles per liter, I mean, it doesn't matter liters, deciliters, it'd just be a factor of 10 difference, but that's a particle count over volume measure. And 1 millimole is about 6 times 10 to the 20th particles. Now you may recognize that number from high school physics. 6.022 times 10 to the 23rd particles is a mole. So a millimole is 1,000th of that. The problem is the particles per mass depends on what the substance is. This isn't like going from kilometers to miles where they're both linear measures. These are actually different measures, so depending on the substance they will convert differently. So that's why we got to be very careful when we're talking about ratios, for example. I always talk about the triglycerides to HDL ratio. The gold standard is 2. That's in US units. That's in milligrams per deciliter. And the platinum standard is 1. But the conversion factors are different. Now you could always convert to the US units and say, okay, But it's just easier if you're on millimoles per liter to just say 0.9 is the gold standard for that ratio and 0.45 is the platinum standard for that ratio. So that answers that question about why these things don't convert the same. So that's what I've got on metabolic syndrome and whether statins help or not. If you appreciate this content, please like, share, subscribe, and comment on topics that you'd like me to address. And if you haven't seen this video, I recommend you take a look at it now. Thanks for listening.